How does a nation build a resilient, sustainable health system in the face of seismic shifts in global funding? This was the critical question at the HEPU Thanzi International Extraordinary Think Tank Conference. On October 16th and 17th, 2025, key stakeholders, researchers, and global partners gathered at the Bingu International Convention Center in Lilongwe. Hosted by the Health Economics and Policy Unit HEPU, housed at the Kamuzu University of Health Science, in collaboration with the Ministry of Health Department of Planning and Policy Development and the Thanzi Program. Their unified goal is to move beyond dependency and forge a new path, exploring sustainable, innovative strategies for a people-centric healthcare system. The theme: Sustainability Planning for Malawi's Health Sector, Innovating for a Resilient Future. This is a summary of that crucial event. The conference began with introductions, overview, and opening remarks. Professor Joseph Putsobengo, the Thanzi La Onse co-principal investigator and director of HEPU, welcomed the delegates. He set a collaborative tone, describing the think tank as a place of cooking together and urging participants to move beyond interdisciplinary work to achieve true transdisciplinary collaboration. He was followed by Professor Tim Hallett, the Thanzi La Onse principal investigator. He expressed gratitude for the wonderful process of long-standing collaboration, praising the think tank as a vital forum for active collaboration and feedback between scientists and policymakers. This theme was echoed by Professor Paul Revel of the Thanzi La Onse program. He explained that the program's core vision is to bring research and policy communities closer together, noting that this Malawian model for evidence-based policy has drawn international attention.
It is my honor today to stand before you humbly, with joy, knowing that that we're going to get a very good food of knowledge, which we'll be cooking today together. Because this is a think tank where somebody does not cook for somebody, but is cooking together.
Prof got the tone exactly right, that it's not a question of finished research projects being presented and digested by anybody. It's a question of collaboration and feedback, and it will all be constructive and very highly valued. So thank you for your time and energy and insight and collaboration today and tomorrow.
And as Professor Tim Hallett has said, what has been done here in Malawi has drawn attentions from countries across the region, in fact, across the world. Personally, I was in Brazil just 2 weeks ago, and some of the work which has been undertaken here in Malawi has drawn the attention from the Ministry of Health and academics in Brazil. That's just one example.
Mr. Edward Gataika, Director of the Thanzi La Onse program for the East, Central and Southern Africa EXA region, then shifted the focus to financing. He delivered a clear call to action, arguing that amid global aid shifts, the health sector must reshape its narrative, moving from being seen as a social cost to a strategic investment in human capital. Representing the Kamuzu University of Health Sciences Vice Chancellor, Associate Professor John Puka reinforced that sustainability is a national imperative. He affirmed the university's mission to train ethical, competent, and highly innovative leaders, and to generate the locally grounded evidence needed to answer Malawi's most critical question: what should we fund? Finally, the conference was officially opened by the guest of honor, Dr. Samson Dolo, the Secretary for Health. He delivered a powerful keynote calling the recent abrupt withdrawal of external aid a critical wake-up call against dependency. Dr. Ndolo stressed that the solution is not to lament lost aid, but to take ownership, first by increasing efficiency, getting more health for the money we have, and then boosting domestic resource mobilization.
Kamuzu University of Health Sciences is fully committed and remains committed to providing intellectual capital, the research rigor, as you hear in the next 2 days, and the policy platform necessary to achieve the health sector resilience. There is high need for adaptations in the current environment.
Distinguished participants, the path to resilient health sector is complex, but it is clear. Achieving it will require difficult decisions, shared responsibility, and unyielding commitment to solidarity and equity as guiding principles. Fortunately, we have a policy framework, the HSSP3, which is already in place, and we have the intellect and expertise gathered here today to guide us forward. I now declare the 17th International Annual Think Tank Conference on Sustainability Planning officially open, and I wish you all a productive week of dialogue and innovation. Zikomo kwambiri.
The focus then shifted to Session 2, optimizing evidence use for health policy decision-making through all disease whole system modeling. Professor Tim Hallett of Imperial College London began by explaining what the TLO model provides, a holistic framework to evaluate health policies from a powerful whole population, all disease, whole healthcare system perspective. Following this, Mr. Watipaso Mulwafo, a research fellow at HEPU, demonstrated a practical tool to make this complex data accessible. He presented an AI-powered chatbot which provides policymakers with faster, user-friendly access to the TLO model's data. This session then moved to specific application. Dr. Rachel Murray Watson presented her findings that climate change, particularly precipitation, causes significant disruptions to healthcare services in Malawi. Her modeling revealed that these disruptions are increasing the national health burden, causing a 1 to 2.4% rise in extra dailies from delayed or cancelled appointments. Mr. Mulwafu then returned to present a study addressing the high risk of blindness from diabetic retinopathy, DR, assessing the value of integrating DR screening and treatment directly into the existing healthcare system. The session closed with an interactive Q&A panel allowing delegates to engage directly with these new tools and findings. Next, Session 3 turned the focus to service delivery integration reform. Dr. Bongani Chikwapulo of the Quality Management Department began by outlining Malawi's practical approach. He explained that the ministry is currently piloting the integration of services, such as chronic disease and maternal child health in Kota and Rumpi districts to identify the best practices for a future national scale-up. This was followed by a central presentation from Professor Joseph Futsobengo. He passionately argued that standard healthcare system models often fail in resource-constrained settings because they overlook the root causes: leadership, ethics, and governance. As a solution, he proposed a LEGS framework: leadership, ethical engagement, governance, and system as the essential foundation. Joining virtually, Dr. Joseph Collins from University College London provided a critical reality check. His modeling showed that while integrating chronic care offers substantial health gain, it also results in significant increase in costs and health worker time, demands that remain high even with hypothetical efficiencies. The session concluded with a high-level panel discussion on achieving sustainability through service delivery integration reforms. Chaired by Professor Paul Reville, the panel tackled the most important and the most urgent questions of the conference, addressing the seismic cuts to overseas development assistance and the intermediate risks to Malawi's healthcare system, such as losing hard-won gains in HIV and maternal health. Attention then turned to Session 4, focusing on the realities of health worker time use, patient costs, and quality of care. Professor Timothy Colborn began by introducing the comprehensive Thanzi La Onse TLM dataset. His initial findings showed that factors like non-governmental facility ownership and reliable medication availability are strongly associated with patients' perceptions of high-quality care. Precious Jitsulo from HEPU followed, highlighting the significant hidden costs faced by patients. His research showed an average 1-hour travel time with major opportunity costs from missing work or farming, burdens that disproportionately affect the poor. Dr. Bingling Shi then presented a time and motion study, finding that while healthcare workers spend a substantial portion of their day on patient-facing care, the time spent per individual patient remains low. Dr. Victoria Tafes provided a direct comparison between government and faith-based CHAM facilities, finding that CHAM health workers are more likely to perform key quality of care activities during consultations, such as physical exams. To conclude, Dr. Bingling Shi returned to argue that with the limited budget, a strategic investment in expanding specific healthcare worker cadres will produce substantially greater health gains than a uniform expansion. The final session of the day, Session 5, addressed advances in HIV, STI diagnosis, and prevention prioritization. Dr. Lakingwira opened by detailing Malawi's progress in institutionalizing a health technology assessment framework, HTA framework, using it to evaluate the cost-effectiveness and sustainability of new HIV interventions. Remotely, Dr. Tara Mango presented modeling on simplifying HIV service delivery. Her analysis provided clear trade-offs, showing where time-saving measures carry minimal health impacts and where they pose significant risks. Professor Anna Burstein also presented remotely, focusing on the new HIV PrEP lenacapavir. Her study concluded that while it's cost-effective for key populations, a price reduction is necessary for broader use. The day's presentations concluded with a critical analysis by Mr. Tulason Suku from Seed Global Health. He detailed the severe financial impact of $62.6 million foreign aid cut, which disproportionately affected the maternal, neonatal, child health and HIV programs, warning that this cut threatens to reverse decades of progress. The day's proceedings were brought to a close after a final session of question and answer by the presenters. Continuing strong from day 1, day 2 began with Professor Joseph Futsobengo taking the stage to provide a comprehensive recap of day 1, synthesizing the powerful discussion on global funding shocks, the need for new efficiency models, and the urgent call for national ownership. With this foundation set, the first session turned to the future of health financing and system strengthening. Atupele Zinkambani, an economist from the Ministry of Health, presented first on the National Health Accounts, NHA. She explained that while the NHA is essential for tracking all health spending, the process is currently irregular and dependent on donors. Therefore, institutionalizing the NHA is a paramount reform to ensure sustainable financing, improve data quality, and build resilience. Her colleague from the ministry, Mr. Dimange Banda, continued this theme by outlining Malawi's strategy for sustainable, government-led health financing. He detailed key reforms aimed at reducing donor dependency, including institutionalizing health technology assessment, HTA, engaging the private sector, and introducing mandatory health insurance for former employees. Joining online from the World Health Organization, Dr. Walter Odochi introduced blended health financing. He presented innovative tools like social impact bonds as ways to mobilize new resources, but emphasized that these models are complements, not substitutes, and must be aligned with robust public investment. The session's focus then shifted from raising funds to managing them effectively. Gabriel Mwana, a HEPU research fellow, presented a plan to assess the impact of service level agreements, SLAs, within CHAM facilities. This study will use the Thanzi La Onse model to compare outcomes in facilities with SLAs, which deliver free services, against those operating without them. Mr. Precious Chitsulo followed with a critical analysis of direct facility financing, DFF. He argued that as Malawi scales up this reform, the autonomy given to facility is not being matched by structured oversight, which reduces accountability. His key message was that reforming community oversight is essential to ensure the DFF reform successfully improves performance. The final presentation provided a specific case study in cost effectiveness. Dr. Eva Yanoskova from University College London shared her modeling on acute malnutrition. Her research found that scaling up interventions like growth monitoring, active care seeking, and food supplement availability are highly effective and would significantly avert child deaths from malnutrition, pneumonia, and diarrhea, fully justifying their cost. The session closed with a lively question and answer period as delegates engaged with all the presenters on these financing and accountability models. The final session of the conference, Areas of Further Research, brought all the delegates into the conversation. Led by Professor Tim Hallett and Professor Joseph Futsobengo, the room was opened up. Participants were asked to share the key takeaways from the past 2 days and to suggest the most critical areas to focus on moving forward. This interactive discussion synthesized the core themes of the event, moving from analysis to a shared action plan, and cementing the cooking together spirit that Professor Joseph Futsobengo had called from the very start. The 17th Think Tank Conference was then officially closed by Dr. Gerard Mantalu, the Director of Planning and Policy Development in the Ministry of Health. He delivered a powerful final message, stressing that the critical partnership between the Ministry of Health and Kamuzu University of Health Sciences is essential for generating local evidence to solve local problems, especially in the face of dwindling resources. Dr. Mantalu stated that this collaboration must prioritize making a real-world difference. He called for research that is efficient, addresses the most highly prioritized questions, and ultimately empowers health facility at the district level. It was a definitive call to action, a mandate to turn the rich discussions of the think tank into tangible, sustainable change for Malawi's health sector. The 2 days in Lilongwe were more than a conference. They were a critical turning point. The key takeaway is clear. National ownership, data-driven efficiency, and innovative financing are no longer just goals, but necessities for survival and growth. Collaborations were formed and strengthened here, and will shape the future of a resilient, self-reliant, and truly Malawian health system. Until next time, thank you for watching.